NCLEX practice exam, select all that apply. Question 1. The nurse is preparing a teaching plan for a client who is undergoing cataract extraction with intraocular implant. Which home care measures will the nurse include in the plan? Option A. Avoid activities that require bending over. Option B. Contact the surgeon if eye scratchiness occurs. Option C. Place an eye shield on the surgical eye at bedtime. Option D. Expect episodes of sudden severe pain in the eye. Option E. Contact the surgeon if a decrease in visual acuity occurs. Option F. Take acetaminophen for minor eye discomfort. The correct answers are options A and C and E and F. Avoid activities that require bending over. Place an eye shield on the surgical eye at bedtime. Contact the surgeon if a decrease in visual acuity occurs. Take acetaminophen for minor eye discomfort. After eye surgery, mild scratchiness is normal, but severe pain can indicate complications like hemorrhage or increased intraocular pressure. Clients should avoid bending over and use an eye shield at night. Question 2. A nurse suspects pulmonary edema in a client with heart failure who develops dyspnea and tachycardia. Which interventions does the nurse expect to be prescribed? Option A. Administering oxygen. Option B. Inserting a Foley catheter. Option C. Administering furosemide. Option D. Administering morphine sulfate intravenously. Option E. Transporting the client to the coronary care unit. Option F. Placing the client in a low Fowler's side lying position. The correct answers are options A and B and C and D. Administering oxygen. Inserting a Foley catheter. Administering furosemide. Administering morphine sulfate intravenously. Oxygen, diuretics like furosemide, and morphine are standard for pulmonary edema. A Foley catheter tracks output. High Fowler's position is preferred over low Fowler's. Question 3. An infant with tetralogy of Fallot suddenly becomes cyanotic with an oxygen saturation of 60%. Which intervention should the nurse perform? Option A. Call a code blue. Option B. Notify the registered nurse. Option C. Place the infant in a prone position. Option D. Prepare to administer morphine sulfate. Option E. Prepare to administer intravenous fluids. Option F. Prepare to administer 100% oxygen by face mask. The correct answers are options B and D and E and F. Notify the registered nurse. Prepare to administer morphine sulfate. Prepare to administer intravenous fluids. Prepare to administer 100% oxygen by face mask. For hypercyanotic episodes, the infant should be placed in a knee-chest position. Morphine, oxygen, and fluids are administered as prescribed. Question 4. A client with lung carcinoma develops syndrome of inappropriate antidiuretic hormone. Which treatments does the nurse anticipate? Option A. Radiation. Option B. Chemotherapy. Option C. Increased fluid intake. Option D. Serum sodium blood levels. Option E. Decreased oral sodium intake. Option F. Medication antagonistic to antidiuretic hormone. The correct answers are options A and B and D and F. Radiation, chemotherapy, serum sodium blood levels, medication antagonistic to antidiuretic hormone. SIAD treatment involves fluid restriction and increased sodium intake. Treating the underlying cancer with radiation or chemotherapy helps normalize hormone levels. Question 5. Which instructions should a nurse include for the parents of a child with a new plaster cast on the forearm? Option A. Use the fingertips to lift the cast while it is drying. Option B. Keep small toys and sharp objects away from the cast. Option C. Use a padded ruler to scratch the skin under the cast. Option D. Place a heating pad over the fingers if they feel cold. Option E. Contact the healthcare provider for numbness or tingling. Option F. Elevate the extremity on pillows for the first 24 to 48 hours. The correct answers are options B and E and F. Keep small toys and sharp objects away from the cast. Contact the healthcare provider for numbness or tingling. Elevate the extremity on pillows for the first 24 to 48 hours. Palms should be used to lift drying casts. Nothing should be placed inside the cast. Cold fingers or numbness indicate neurovascular issues and require medical attention. Question 6. A pregnant woman has a history of genital herpes but no active lesions. What information should the nurse provide? Option A. You will be isolated from your newborn after delivery. Option B. There is little risk to your baby during birth and delivery. Option C. Vaginal deliveries reduce infection risks even with active lesions. Option D. A cesarean delivery is needed if herpetic lesions are present at birth. The correct answer is option D. A cesarean delivery is needed if herpetic lesions are present at birth. Cesarean delivery is necessary only if active lesions are present at the time of delivery to prevent neonatal infection. Question 7. Which intervention should be included in the plan of care for a client with an internal radiation implant? Option A. Wearing gloves when emptying the client's bedpan. Option B. Keeping all linens in the room until the implant is removed. Option C. Wearing a film dosimeter badge when in the client's room. Option D, wearing a lead apron when providing direct care. Option E, placing the client in a semi-private room. The correct answers are options A and B and C and D, wearing gloves when emptying the client's bedpan, keeping all linens in the room until the implant is removed, wearing a film dosimeter badge when in the client's room, wearing a lead apron when providing direct care. Safety precautions for internal radiation include private rooms, lead aprons, dosimeter badges, and careful handling of linens and body fluids. Question 8. A child is diagnosed with meningococcal meningitis. Which isolation technique is appropriate? Option A, enteric precautions. Option B, neutropenic precautions. Option C, no precautions are required once antibiotics start. Option D, isolation for at least 24 hours after starting antibiotics. The correct answer is option D, isolation for at least 24 hours after starting antibiotics. Meningococcal meningitis requires droplet precautions for at least 24 hours after the initiation of effective antibiotic therapy. Question 9. Which toy is most appropriate for a 3-year-old child? Option A, a puzzle with many small pieces. Option B, a wagon. Option C, a golf set. Option D, a farm set with small animals. The correct answer is option B, a wagon. Toddlers need sturdy toys that do not pose a choking hazard. Push-pull toys like wagons are appropriate for this age group. Question 10. At what point is it generally safe to place a toddler in a face-forward car safety seat? Option A, when the toddler weighs 20 pounds and is 1 year old. Option B, when the weight of the toddler is more than 40 pounds. Option C, only if there are safety locks in the car. Option D, never, due to the risk of unbuckling the harness. The correct answer is option A, when the toddler weighs 20 pounds and is 1 year old. Standard guidelines generally allow the switch to a forward-facing seat once the child is at least 1 year old and weighs 20 pounds. Question 11. A nurse is providing colostomy care to a client with methicillin-resistant Staphylococcus aureus on contact precautions. Which items are required? Option A, gloves and a gown. Option B, gloves and goggles. Option C, gloves, a gown, and goggles. Option D, gloves, a gown, and shoe protectors. The correct answer is option C, gloves, a gown, and goggles. Contact precautions require gloves and a gown. Goggles are added when performing procedures that may cause splashing, such as colostomy care. Question 12. While changing a hospital gown for a client with a peripheral intravenous infusion, which action should the nurse avoid? Option A, using a hospital gown with snaps at the sleeves. Option B, disconnecting the intravenous tubing from the catheter. Option C, checking the flow rate immediately after the change. Option D, putting the bag and tubing through the sleeve first. The correct answer is option B, disconnecting the intravenous tubing from the catheter. Intravenous lines should not be disconnected to change a gown as it increases the risk of infection. Use gowns with snaps or thread the bag through the sleeve. Question 13. Which of the following is a characteristic of the team nursing model of practice? Option A, a task approach method is used for care. Option B, managed care tools are used for all interventions. Option C, nursing staff are led by a nurse to care for a group of clients. Option D, a single registered nurse is responsible for the entire group. The correct answer is option C, nursing staff are led by a nurse to care for a group of clients. Team nursing involves a team leader who coordinates a group of licensed and unlicensed personnel to provide care to a group of clients. Question 14. A nurse in the emergency department is performing triage. Which client should receive the highest priority? Option A, a client with muscle aches and a headache. Option B, a client with a twisted ankle from rollerblading. Option C, a client with a minor finger laceration. Option D, a client with chest pain after eating spicy pizza. The correct answer is option D, a client with chest pain after eating spicy pizza. Chest pain is always treated as an emergent priority until a cardiac cause is ruled out, ranking higher than minor trauma or viral symptoms. Question 15. A nurse is planning rounds for 4 clients. Which client should the nurse check first? Option A, a client on a ventilator. Option B, a client in skeletal traction. Option C, a postoperative client preparing for discharge. Option D, a client admitted with gastroenteritis. The correct answer is option A, a client on a ventilator. Airway and breathing are the highest priorities. A client on a mechanical ventilator requires the most immediate assessment. Question 16. A mother is being instructed on home care for a child with croup. Which statement indicates a need for further instruction? Option A, I will give my child cough syrup if a cough develops. Option B, during an attack, I will take my child to a cool location. Option C, I will give acetaminophen if my child develops a fever. Option D, I will ensure my child drinks 3 to 4 glasses of fluid daily. The correct answer is option A, I will give my child cough syrup if a cough develops. Cough syrups are avoided in croup because they can dry out and thicken secretions, making breathing more difficult. Question 17. Which nursing action constitutes a violation of a client's right to privacy? Option A. Threatening to place a client in restraints. Option B. Performing a surgical procedure without consent. Option C. Taking photographs of the client without consent. Option D. Telling the client they cannot leave the hospital. The correct answer is option C. Taking photographs of the client without consent. Unauthorized photography is an invasion of privacy. Threatening restraints is assault, surgery without consent is battery, and preventing exit is false imprisonment. Question 18. Parents of a toddler show understanding of burn prevention by making which of the following statements? Option A. We will be sure to not leave hot liquids unattended. Option B. My child needs to understand what the word hot means. Option C. Our child will stay in his room when we work in the kitchen. Option D. We will install a safety gate so he cannot enter the kitchen. The correct answer is option A. We will be sure to not leave hot liquids unattended. Supervision and keeping hot items out of reach are the most effective ways to prevent burns in active toddlers. Question 19. A nurse observes a client with diabetic ketoacidosis experiencing Kussmaul's respirations. What does the nurse observe? Option A. Respirations that cease for several seconds. Option B. Respirations that are regular but abnormally slow. Option C. Respirations that are labored and increased in depth and rate. Option D. Respirations that are abnormally deep, regular, and increased in rate. The correct answer is option D. Respirations that are abnormally deep, regular, and increased in rate. Kussmaul's respirations are the body's attempt to blow off carbon dioxide to compensate for metabolic acidosis, characterized by deep, rapid breathing. Question 20. During the admission of an African American client for surgery, which information is considered the least priority? Option A. Respiratory status. Option B. Psychosocial data. Option C. Neurological status. Option D. Cardiovascular status. The correct answer is option B. Psychosocial data. Physiological assessments are always the priority. In some cultures, personal psychosocial questions may be viewed as intrusive during the initial meeting. Question 21. A client has a nasogastric tube attached to low suction. The nurse monitors for which acid-base disorder? Option A. Metabolic acidosis. Option B. Metabolic alkalosis. Option C. Respiratory acidosis. Option D. Respiratory alkalosis. The correct answer is option B. Metabolic alkalosis. The loss of gastric acid, hydrochloric acid, through suction or vomiting leads to an increase in body alkalinity, known as metabolic alkalosis. Question 22. A client with leukemia has poor skin turgor and flat neck veins. What additional sign suggests hyponatremia? Option A. Intense thirst. Option B. Slow bounding pulse. Option C. Dry mucous membranes. Option D. Postural blood pressure changes. The correct answer is option D. Postural blood pressure changes. Postural hypotension is a sign of hyponatremia. Thirst and dry membranes are more typical of hypernatremia. Question 23. Which of the following clients should be specifically instructed not to take herbal medications at home? Option A. A 60-year-old male with rhinitis. Option B. A 24-year-old male with a back injury. Option C. A 10-year-old female with a urinary tract infection. Option D. A 45-year-old female with migraines. The correct answer is option C. A 10-year-old female with a urinary tract infection. Children should not use herbal therapies without professional supervision due to risks of unknown interactions and dosages. Question 24. Which client is at the highest risk for developing a fluid volume deficit? Option A. A client with cirrhosis. Option B. A client with a colostomy. Option C. A client with decreased kidney function. Option D. A client with congestive heart failure. The correct answer is option B. A client with a colostomy. Colostomies and ileostomies increase the risk of fluid loss. Cirrhosis, heart failure, and kidney failure typically cause fluid volume excess. Question 25. A client is to receive 1,000 milliliters of normal saline over 10 hours. The drop factor is 15 drops per milliliter. What is the flow rate in drops per minute? Option A. 15 drops per minute. Option B. 20 drops per minute. Option C. 25 drops per minute. Option D. 30 drops per minute. The correct answer is option C. 25 drops per minute. 1,000 milliliters divided by 600 minutes, 10 hours, multiplied by 15 equals 25 drops per minute. Question 26. Using the rule of nines, calculate the burn percentage for a client with burns to the entire face, upper anterior torso, lower halves of both arms, posterior head, and upper posterior torso. Option A 18%, Option B 27%, Option C 36%, Option D 45%. The correct answer is Option C, 36%. Face, 4.5, plus upper anterior torso, 9, plus lower arms, 9, plus posterior head, 4.5, plus upper posterior torso, 9, equals 36%. Question 27. A nurse is caring for a client who lost a neighbor in a fire. Which action helps the client work through the meaning of the crisis? Option A, identifying the client's ability to function. Option B, identifying the client's potential for self-harm. Option C, inquiring about the client's feelings that affect coping. Option D, inquiring about the cause of the neighbor's death. The correct answer is Option C, inquiring about the client's feelings that affect coping. Coping with a crisis requires addressing the emotional responses and feelings before the client can process the event logically. Question 28. Which data indicates that a client may be experiencing ineffective coping after a loss? Option A, constantly neglects personal grooming. Option B, visits her husband's grave once a month. Option C, visits the senior citizen center once a month. Option D, frequently looks at snapshots of her husband. The correct answer is Option A, constantly neglects personal grooming. Neglecting self-care and hygiene is a red flag for ineffective coping or clinical depression following a major life stressor. Question 29. Which assignment is most appropriate for a nursing assistant? Option A, a client who requires wound irrigation. Option B, a client who requires frequent ambulation. Option C, a client who is receiving continuous tube feedings. Option D, a client who requires frequent vital signs after cardiac catheterization. The correct answer is Option B, a client who requires frequent ambulation. Ambulation is a standard task within the scope of a nursing assistant. Irrigation, tube feedings, and post-procedural monitoring require licensed nursing judgment. Question 30. A nurse is asked to witness a client's signature on a living will. What is the appropriate nursing action? Option A, decline to sign the will. Option B, sign the will as a witness to the signature only. Option C, call the hospital lawyer before signing. Option D, sign the will and identify employment credentials. The correct answer is Option A, decline to sign the will. Many states and facility policies prohibit employees from witnessing legal documents like living wills for clients under their care to avoid conflicts of interest. Question 31. An unconscious, bleeding client needs emergency surgery to save their life. No family is present. What is the best action regarding informed consent? Option A, call the supervisor to initiate a court order. Option B, try calling the spouse before the procedure. Option C, ask the friend who accompanied the client to sign. Option D, transport the client to surgery immediately without a signed consent. The correct answer is Option D, transport the client to surgery immediately without a signed consent. In life-threatening emergencies where delay would cause harm, consent is implied, and treatment can proceed without formal documentation. Question 32. A family member refuses to discuss funeral arrangements for a deceased client. What is the nurse's appropriate action? Option A, show acceptance of feelings. Option B, provide information needed for decision-making. Option C, suggest a referral to a mental health professional. Option D, remain with the family member without discussing arrangements. The correct answer is Option D, remain with the family member without discussing arrangements. During the denial stage of grief, the nurse should provide a supportive presence without forcing the family to confront the reality before they are ready. Question 33. A nurse is caring for a client after a thyroidectomy. For which reason is calcium gluconate most likely prescribed? Option A, to treat thyroid storm. Option B, to prevent cardiac irritability. Option C, to treat hypocalcemic tetany. Option D, to stimulate the release of parathyroid hormone. The correct answer is Option C, to treat hypocalcemic tetany. Thyroid surgery can accidentally damage the parathyroid glands, leading to low calcium levels and tetany, which requires calcium gluconate. Question 34. What is the primary action of the medication tamoxifen when used for metastatic breast carcinoma? Option A, increase DNA and RNA synthesis. Option B, promote the biosynthesis of nucleic acids. Option C, increase estrogen concentration. Option D, compete with estradiol for estrogen binding sites. The correct answer is Option D, compete with estradiol for estrogen binding sites. Tamoxifen is an estrogen antagonist that competes for binding sites in tissues with high estrogen receptor concentrations. Question 35. A client with hyperparathyroidism has a serum calcium level of 13 mg per deciliter. Which medication should the nurse prepare? Option A, calcium chloride. Option B, calcium gluconate. Option C, calcitonin. Option D, large doses of vitamin D. The correct answer is option C, calcitonin. Calcitonin helps lower high serum calcium levels by inhibiting bone resorption and increasing renal excretion of calcium. Question 36. A nurse is assigned 6 clients. In which order should the nurse check them, from highest to lowest priority? Option A, tracheostomy with ventilator, insulin, cardiac catheterization, medications, discharge, physical therapy. Option B, insulin, cardiac catheterization, tracheostomy with ventilator, medications, discharge, physical therapy. Option C, cardiac catheterization, tracheostomy with ventilator, insulin, medications, discharge, physical therapy. Option D, tracheostomy with ventilator, cardiac catheterization, insulin, medications, discharge, physical therapy. The correct answer is option A, tracheostomy with ventilator, insulin, cardiac catheterization, medications, discharge, physical therapy. Airway, ventilator, is first, followed by time-sensitive tasks like insulin and scheduled procedures. Question 37. Which findings are considered normal physiological changes in an older adult? Option A, increased heart rate. Option B, decline in visual acuity. Option C, decreased respiratory rate. Option D, decline in long-term memory. Option E, increased susceptibility to urinary tract infections. Option F, increased incidence of awakening after sleep onset. The correct answers are options B and E and F. Decline in visual acuity, increased susceptibility to urinary tract infections, increased incidence of awakening after sleep onset. Aging leads to vision changes, increased UTI risk, and altered sleep patterns. Long-term memory is usually maintained, and heart rate typically decreases. Question 38. A client is recovering from a supratentorial craniotomy. Which positions are safe for the client? Option A, on the left, operative, side. Option B, with the neck flexed. Option C, supine on the left side. Option D, with extreme hip flexion. Option E, in a semi-Fowler's position. Option F, with the head in a midline position. The correct answers are options E and F, in a semi-Fowler's position, with the head in a midline position. The head should be elevated 30 degrees, semi-Fowler's, and kept midline. Positioning on the operative side or flexing the neck/hips is avoided. Question 39. How can anthrax be transmitted to humans? Option A, through the skin. Option B, by kissing. Option C, by inhalation. Option D, through the gastrointestinal system. Option E, direct contact with an infected individual. Option F, sexual contact with an infected individual. The correct answers are options A and C and D, through the skin, by inhalation, through the gastrointestinal system. Anthrax is transmitted via skin contact, inhalation, or ingestion. It is not spread from person to person. Question 40. Which clients are at the highest risk for developing circulatory overload? Option A, a premature infant. Option B, a 101-year-old man. Option C, a client on renal dialysis. Option D, a client with diabetes mellitus. Option E, a 29-year-old woman with pneumonia. Option F, a client with congestive heart failure. The correct answers are options A and B and C and F, a premature infant, a 101-year-old man, a client on renal dialysis, a client with congestive heart failure. The very young, the very old, and those with heart or kidney disease have a lower tolerance for fluid volume changes. Question 41. Which findings indicate that a client is experiencing side effects of phenytoin? Option A, ataxia. Option B, sedation. Option C, constipation. Option D, bleeding gums. Option E, hyperglycemia. Option F, decreased platelet count. The correct answers are options C and D and E and F, constipation, bleeding gums, hyperglycemia, decreased platelet count. Phenytoin, dilantin, commonly causes gingival hyperplasia, constipation, high blood sugar, and potential blood dyscrasias. Question 42. A client is scheduled for a myelogram. Which instructions should be provided? Option A, jewelry will need to be removed. Option B, an informed consent will need to be signed. Option C, a trained X-ray technician performs the procedure. Option D, the procedure will take approximately 45 minutes. Option E, a liquid diet can be consumed on the day of the procedure. Option F, solid food intake needs to be restricted only on the test day. The correct answers are options A and B and D. Jewelry will need to be removed. An informed consent will need to be signed. The procedure will take approximately 45 minutes. Myelograms require NPO status for 4 to 8 hours and a signed consent. Jewelry must be removed. The procedure is performed by a physician. Question 43. Which intervention should be included in the plan of care after a lumbar puncture? Option A, monitor the client's ability to void. Option B, maintain the client in a flat position. Option C, restrict fluid intake for 2 hours. Option D, monitor the ability to move extremities. Option E, inspect the site for swelling or drainage. Option F, maintain NPO status for 24 hours. The correct answers are options A and B and D and E. Monitor the client's ability to void. Maintain the client in a flat position. Monitor the ability to move extremities. Inspect the site for swelling or drainage. Post-procedure care involves lying flat, encouraging fluids, and monitoring neurovascular status and the puncture site. Question 44. A client has a positive Cross-X sign. What other data would the nurse expect to find? Option A, coma. Option B, tetany. Option C, diarrhea. Option D, possible seizure activity. Option E, hypoactive bowel sounds. Option F, positive Trousseau sign. The correct answers are options B and C and D and F, tetany, diarrhea, possible seizure activity, positive Trousseau sign. Cross-X and Trousseau signs indicate hypocalcemia, which also causes tetany, seizures, and hyperactive bowel sounds, diarrhea. Question 45. Which measures help prevent Lyme disease during a hike? Option A, tuck pant legs into socks. Option B, wear closed shoes when hiking. Option C, apply insect repellent containing DEET. Option D, cover the ground with a blanket when sitting. Option E, remove attached ticks with thumb and forefinger. Option F, wear long sleeves and pants in dark colors. The correct answers are options A and B and C and D. Tuck pant legs into socks. Wear closed shoes when hiking. Apply insect repellent containing DEET. Cover the ground with a blanket when sitting. Prevention involves covering skin, using DEET, and avoiding direct ground contact. Ticks should be removed with tweezers, and light-colored clothing is preferred. Question 46. A client with hypernatremia has flushed skin and a sodium level of 172. Which interventions are anticipated? Option A, monitor intake and output. Option B, monitor vital signs. Option C, maintain sodium-reduced diet. Option D, monitor electrolyte levels. Option E, increase water intake orally. Option F, administer sodium replacements. The correct answers are options A and B and C and D and E. Monitor intake and output. Monitor vital signs. Maintain sodium-reduced diet. Monitor electrolyte levels. Increase water intake orally. Hypernatremia treatment focuses on reducing sodium and increasing water. Sodium replacements are contraindicated. Question 47. A client with Cushing's syndrome has fluid overload. Which intervention should be included? Option A, monitoring daily weight. Option B, monitoring intake and output. Option C, maintaining a low-potassium diet. Option D, monitoring extremities for edema. Option E, maintaining a low-sodium diet. The correct answers are options A and B and D and E. Monitoring daily weight. Monitoring intake and output. Monitoring extremities for edema. Maintaining a low-sodium diet. Cushing's syndrome requires a high potassium and low-sodium diet to manage fluid retention and electrolyte imbalances. Question 48. A nurse is monitoring for thyrotoxic crisis. Which signs alert the nurse to this condition? Option A, bradycardia. Option B, fever. Option C, sweating. Option D, agitation. Option E, pallor. The correct answers are options B and C and D, fever, sweating, agitation. Thyroid storm is characterized by high fever, severe tachycardia, flushing, sweating, and extreme agitation. Question 49. Which statements about exercise for a client with hyperparathyroidism require further instruction? Option A. I enjoy exercising but I need to be careful. Option B. I need to pace my activities throughout the day. Option C. I need to limit playing football to only the weekends. Option D. I should gauge my activity level by my energy level. Option E. I should exercise in the evening for better sleep. The correct answers are options C and E. I need to limit playing football to only the weekends. I should exercise in the evening for better sleep. Contact sports should be completely avoided to prevent fractures. Evening exercise can disrupt sleep. Question 50. Which findings support a diagnosis of chronic bronchitis over emphysema? Option A, scant mucus. Option B, early onset cough. Option C, marked weight loss. Option D, purulent mucus production. Option E, mild episodes of dyspnea. The correct answers are options B and D and E, early onset cough, purulent mucus production, mild episodes of dyspnea. Chronic bronchitis features early cough, heavy mucus, and less severe weight loss/dyspnea compared to emphysema. Question 51. Which medications are commonly used to treat heart failure? Option A, diuretics. Option B, anticoagulants. Option C, anticholinergics. Option D, cardiac glycosides. Option E, phosphodiesterase inhibitors. Option F, angiotensin-converting enzyme inhibitors. The correct answers are options A and D and E and F, diuretics, cardiac glycosides, phosphodiesterase inhibitors, angiotensin-converting enzyme inhibitors. Standard heart failure meds include diuretics, digoxin, PDE inhibitors, and ACE inhibitors. Question 52. Which instructions should be provided to a client taking nifedipine for blood pressure? Option A, increase water intake. Option B, increase calcium intake. Option C, take pulse rate each day. Option D, weigh at the same time each day. Option E, palpitations may occur early in therapy. Option F, be careful when rising from sitting to standing. The correct answers are option C and D and E and F. Take pulse rate each day, weigh at the same time each day, palpitations may occur early in therapy, be careful when rising from sitting to standing. Nifedipine can cause orthostatic hypotension and palpitations. Weight and pulse should be monitored regularly. Question 53. Which instructions apply to a client taking acarbose for diabetes mellitus? Option A, take the medication at bedtime. Option B, take the medication with each meal. Option C, take the medication on an empty stomach. Option D, side effects include abdominal bloating and flatus. Option E, take some form of glucose if hypoglycemia occurs. Option F, report symptoms such as shortness of breath or tiredness. The correct answers are options B and D and E and F. Take the medication with each meal. Side effects include abdominal bloating and flatus. Take some form of glucose if hypoglycemia occurs. Report symptoms such as shortness of breath or tiredness. Acarbose must be taken with meals. It can cause GI upset and anemia, tiredness. Pure glucose is needed for hypoglycemia because the drug blocks complex sugar breakdown. Question 54. Which interventions are required for a hospitalized neutropenic child? Option A, restrict all visitors. Option B, place the child on a low-bacteria diet. Option C, change dressings using sterile technique. Option D, encourage consumption of fresh fruits and vegetables. Option E, perform meticulous handwashing before care. Option F, allow fresh-cut flowers in the room. The correct answers are options B and C and E. Place the child on a low-bacteria diet. Change dressings using sterile technique. Perform meticulous handwashing before care. Neutropenic precautions include low-bacteria diets, sterile dressing changes, and strict handwashing. Raw produce and flowers are prohibited. Question 55. The prescription is for 0.4 mg of atropine sulfate. The label reads 0.3 mg per 0.5 milliliters. How many milliliters will the nurse administer? Option A, 0.5 milliliters. Option B, 0.6 milliliters. Option C, 0.7 milliliters. Option D, 0.8 milliliters. The correct answer is option C, 0.7 milliliters. 0.4 divided by 0.3 multiplied by 0.5 equals 0.67, which rounds to 0.7 milliliters. Question 56. The prescription is for levothyroxine 150 micrograms daily. The label reads 0.1 milligrams per tablet. How many tablets will the nurse administer? Option A, 1 tablet. Option B, 1.5 tablets. Option C, 2 tablets. Option D, 2.5 tablets. The correct answer is option B, 1.5 tablets. 150 micrograms equals 0.15 milligrams. 0.15 divided by 0.1 equals 1.5 tablets. Question 57. A client has a stoma after a total laryngectomy. What instructions should the nurse provide? Option A, protect the stoma from water. Option B, soaps should be avoided near the stoma. Option C, wash the stoma daily using a washcloth. Option D, use diluted alcohol on the stoma to clean it. Option E, apply a thin layer of petroleum jelly to the surrounding skin. Option F, use soft tissues to clean accumulated secretions. The correct answers are options A and B and C and E. Protect the stoma from water. Soaps should be avoided near the stoma. Wash the stoma daily using a washcloth. Apply a thin layer of petroleum jelly to the surrounding skin. Stoma care involves daily washing with water, avoiding soap/tissues that shed particles, and applying petroleum jelly to prevent skin cracking. Question 58. Which findings would a nurse note in a client with severe preeclampsia? Option A, oliguria. Option B, seizures. Option C, contractions. Option D, proteinuria 3 positive. Option E, muscle cramps. Option F, blood pressure 168/116 millimeters of mercury. The correct answers are options A and D and F. Oliguria, proteinuria 3 positive, blood pressure 168/116 millimeters of mercury. Severe preeclampsia is marked by high BP, high proteinuria, and low urine output. Seizures indicate eclampsia. Question 59. A client is scheduled for an electroencephalogram. Which instructions should be provided? Option A, cola is acceptable to drink on the test day. Option B, tea and coffee are restricted on the test day. Option C, The test will take between 45 minutes and 2 hours. Option D. The hair should be washed the evening before the test. Option E. All medications need to be withheld on the test day. Option F. A nothing by mouth status is required. The correct answers are options B and C and D. Tea and coffee are restricted on the test day. The test will take between 45 minutes and 2 hours. The hair should be washed the evening before the test. EEG prep requires avoiding stimulants like caffeine but does not require fasting or stopping all medications. Hair should be clean and free of products. Question 60. Which medications are used for the long-term control of tonic-clonic seizures? Option A. Diazepam. Option B. Alprazolam. Option C. Gabapentin. Option D. Ethosuximide. Option E. Carbamazepine. Option F. Methylphenidate. The correct answers are options C and D and E. Gabapentin, ethosuximide, carbamazepine. Gabapentin, ethosuximide, and carbamazepine are maintenance anticonvulsants. Diazepam is used for acute seizure termination. Question 61. Which clients are at the highest risk for metabolic acidosis? Option A. Severely anxious client. Option B. Pneumonia client. Option C. Diabetic mellitus client. Option D. Malnourished client. Option E. Asthma client. Option F. Renal failure client. The correct answers are options C and D and F. Diabetic mellitus client, malnourished client, renal failure client. Metabolic acidosis occurs with kidney failure, diabetic ketoacidosis, and starvation/malnutrition. The others are respiratory issues. Question 62. Which nursing interventions are appropriate after retinal detachment surgery? Option A. Monitor for hemorrhage. Option B. Administer eye medications. Option C. Maintain the eye patch or shield. Option D. Assist with activities of daily living. Option E. Encourage coughing and deep breathing. Option F. Educate regarding symptoms of retinal detachment. The correct answers are options A and B and C and D and F. Monitor for hemorrhage. Administer eye medications. Maintain the eye patch or shield. Assist with activities of daily living. Educate regarding symptoms of retinal detachment. Post-op care includes eye protection, meds, and monitoring for further detachment. Coughing is avoided because it increases intraocular pressure,